Hello, good morning everyone. Welcome back to our SC Pharma YouTube channel. Today we are going to start with the second chapter of Pharmacotherapeutics subject, that is cardiovascular system, and in this system we are going to start with the hypertension disease. Hypertension. The definition of hypertension is hypertension, that is the high blood pressure. It is when the pressure in your blood vessels is too high, that is more than 140 90 mmHg. That is hypertension means when excess pressure occurs on your blood vessels. The normal range of blood pressure is 120 to 80 mmHg. As it is very common disorder, particularly in the past Middle Ages, it is not a disease itself, but it can act as an important risk factor for cardiovascular mortality and morbidity. Blood pressure. Blood pressure is the pressure which is exerted by the blood on the arteries and the blood vessels. It is the amount of force exerted on the walls of the arteries as the blood circulates in a body. Means blood pressure is when the blood circulates in a body. At that time, how much force is exerted on the walls of arteries is calculated, and it is called as a blood pressure. Next is categories of hypertension. Normal. In normal condition, the systolic blood pressure will be less than 120 and the diastolic blood pressure will be less than 80. In prehypertension condition, the systolic blood pressure will be 120 to 139 and diastolic will be 80 to 89. Hypertension, that is stage 1 hypertension, systolic blood pressure will be 140 to 159 and diastolic will be 90 to 99. Stage 2 hypertension, the systolic blood pressure will be more than or equal to 160 and the diastolic blood pressure will be more than or equal to 100. We can see the person is suffering from the hypertension condition if his or her arterial blood pressure measured will be more than 140 to 90 mmHg. Next point is the types of hypertension. On the basis of etiology, the hypertension is divided into two types, that is primary hypertension and the second is the secondary hypertension. First is the primary hypertension. Primary hypertension indicates that no definite medical cause can be found to explain a patient's condition, and 95% of the populations are suffered from this type of hypertension, that is the primary hypertension. It has no cure, but it can only be controlled. This type is also called as the essential hypertension. Primary hypertension tends to develop gradually over many years. It may appear due to the non-specific lifestyle and the genetic factors. Lifestyle factors that can increase the risk of hypertension are, that is excess alcohol intake, variation in the renin-angiotensin system, stress and the increased salt intake. Next is the secondary hypertension. Secondary hypertension is due to the complications of the other diseases such as Cushing's syndrome, that is overproduction of the glucocorticoids, hypothyroidism, kidney impairment, pregnancy, or pheochromocytoma, that is cancer of the adrenal medulla. Next, we are going to see the etiopathogenesis of pharmacotherapeutics. First, in that we are going to see the etiology part. Although the exact cause of hypertension is not known, but the various risk factors may contribute, which are high salt intake in the diet, smoking, being overweight or obesity, too much alcohol consumption, and the stress. These are the risk factors which may cause the hypertension. Next risk factors are lack of physical activity, older age, genetic factors, family history of high blood pressure, chronic kidney diseases, adrenal and the thyroid disorders. Next, pathophysiology. There are some important pathophysiological mechanisms which are involved in the hypertension. First one is the overactivation of the RAS system, that is renin angiotensin aldosterone system. Second is the salt sensitivity, and the third one is the activation of sympathetic nervous system. First it is overactivation of RAS system. Overactivation of the RAS leads to the vasoconstriction and retention of the sodium and water, which increases the blood pressure and which eventually leads to the hypertension. Second is the salt sensitivity. This is due to the fact that increased amount of salts in a person's bloodstream may cause the blood to draw more water, which may increase the pressure on the walls of the blood vessels. Third is the activation of sympathetic nervous system. When the blood pressure drops, the sympathetic nervous system is activated, and this increased sympathetic nervous system activity increases the heart rate and the cardiac contraction. The increased heart rate and cardiac contraction produces vasoconstriction in the peripheral arterioles and promotes the release of more renin from the kidney. The net effect of the sympathetic nervous system will be the activation which leads to increase the arterial blood pressure by increasing the cardiac output and the systemic vascular resistance. Next, clinical manifestations, which means the signs and symptoms of the disease. That is increased blood pressure, headache, anxiety, shortness of breath, nose bleeding, confusion, vision changes, dizziness, tiredness, chest pain. Next point is the diagnosis. We can get diagnosed by the history collection and the physical examination, BP measurement, and by the ECG. Next, treatment. We are going to see both treatment, that is non-pharmacological treatment as well as the pharmacological treatment. First, in non-pharmacological treatment, the non-pharmacological management of hypertension is possible by the modification in the lifestyle. The lifestyle modification majorly includes the physical activity, dietary sodium restriction, DASH diet, that is dietary approaches to stop the hypertension, weight reduction, avoiding the smoking, avoid alcohol consumption, and stress management. These are the non-pharmacological treatment for the hypertension disease. Next, pharmacological treatment. Pharmacological treatments means management of hypertension with the help of drugs. Collectively, these drugs are called as antihypertensive drugs. These are, first one is the diuretic. Diuretics are the drugs which increases the urine output by helping the kidneys to inhibit the sodium reabsorption in the distal convoluted tubules, ascending limb and loop of Henle. Examples of diuretics are hydrochlorothiazide, chlorthalidone, and the furosemide. Next, beta blockers. These drugs reduces the workload of the heart and the blood vessels and causing the heart to beat slowly and with the less force. Examples are the propranolol and atenolol. Next, alpha blockers. These drugs causes the peripheral vasodilation of the blood vessels. Examples, prazosin. Next is the calcium channel blockers. These drugs block the movement of extracellular calcium into the cells and causing the vasodilation and decreased heart rate. Examples, nifedipine and amlodipine. Next is the ACE inhibitors, that is angiotensin converting enzyme inhibitors. These drugs inhibit the angiotensin converting enzyme, which reduces the conversion of angiotensin 1 to angiotensin 2 and prevents the vasoconstriction. Examples of ACE inhibitors are captopril, ramipril, and enalapril. Next is the vasodilators. These medicines directly act on the muscles of arterial wall and prevent the muscles from tightening and arteries from narrowing. Examples of vasodilators are hydralazine, nitroglycerin, and sodium nitroprusside. By this way, we have completed the first disease of cardiovascular system, that is hypertension. We have included in this the definition, the causes, that is etiology, pathogenesis, and treatment, that is non-pharmacological and pharmacological treatment. We have included all these parameters in this video. Please like, share and subscribe for more such videos. Thank you.